Hello again. Riverlea residents in Johannesburg are fearing for the lives of their children, rather. My colleague Nqobile Madlala is about to tell us why. Just give us some context in terms of what is happening here. Nqobile.
Well, basically, this is a place that we understand from the lady that we spoke to, that in the 1960s, they were basically just put in between, they were relocated into the area, and they were put between two mine dumps. Now, what she tells us is that in the years, they've basically have been inhaling the golden dust, and this is the fine gold that has basically ate away their lungs. As a result, the whole place has people who have respiratory problems, some of them even being dependent on the oxygen tanks. Now, they're saying that under the pandemic itself, they're finding that it's very difficult to live where they are. They're worried that they're not in a condition where they are able to fight the pandemic in terms of health. But now they're saying that they really would like the government to consider and perhaps assist them in making sure that their kids never have to face the same health implications, saying that over the time they've seen how it has affected them, but now they're seeing that even younger kids are born in a deformed state. They are worried that some of them have even had families where they've had their mothers, fathers die over issues that are related to respiratory problems, and they're saying this is because of the mine dumps that are around them. So we got to speak to them and we got to understand a little bit more. So let's listen into what they have to say.
I'm crying for the children that's going to stay back in the Riverlea extension.
A cry for help. Patricia Rosalind Blackies knows all too well what gold mine dust can do to one's health. She says while the country fights the COVID-19 pandemic, the Riverlea community has more than one battle, one that started pre-democracy when they were relocated here. Now the residents' health has suffered the consequences of living near mine dumps.
Even the children are suffering from eczema. They got eczema. They've got heart problems. Children are undeveloped. They are born undeveloped.
She's trying to comply with COVID-19 safety protocols by using masks, but that is proving tough.
The mask that you got, I can't put that mask on, because I won't be able to breathe.
A study done by the South African Medical Research Council, together with the City of Joburg and University of Johannesburg, found communities like Riverlea continue to live under harsh conditions. The area was constructed in the early 1960s with a population of approximately 24,000 people, and adding a pandemic to the mix can be a catalyst for disaster.
They have so much stacked against them when it comes to preventing, treating and recovering from COVID-19. The first thing to mention is the location of Riverlea. It is located alongside or very close to two large mine dumps.
Community activists are now worried about COVID-19 infections sweeping across these streets and what impact residents' prior health problems will have. Nqobile Madlala, Riverlea, Johannesburg.